Disclaimer, I'm a law student, and the legal information provided is not legal advice. For that, please hire an attorney. Hi, let's begin with a hypothetical. Let's say that you come from a conservative-leaning family. In fact, let's even say that it's a more centrist family, just for the sake of completeness, but someone like a family that generally will vote Republican in most major elections. Let's say that you come from this family and you are yourself more progressive, more left-leaning, right, in comparison. And let's say that you recently have been talking to your family about, among other things, the national pandemic. Let's say that when you talk to your family members, it can be a little frustrating sometimes, but it can also just be difficult because you find yourself struggling to be able to communicate to them the importance of what's happening. You find them often bringing up things like allegations that people are inflating the numbers of how many COVID cases are being reported. You find them bringing up certain theories or conspiracy theories like that maybe everyone has already been infected with COVID, and actually all of this is just a dramatic or an dramatication, an overinflation of what had actually happened. And let's say that you're in a position where you find that it's hard to be able to have this kind of conversation with them, because as you are talking to them, it seems like their mind is already sort of set. Question: what can you really be able to tell them in order to adequately change their mind on this subject? Hey everyone, welcome to the stream. It's great to have everyone here. And yeah, God, it's been a busy week. Listen, every week nowadays it's like we are living in the worst timeline, right? The world is ending. We have a pandemic. The president is basically an out and about fascist, if not just an outright fascist. The election is happening related to that. The world is on fire. There's a lot, right? But yeah, it's been a very interesting week, right? And we're going to be covering a lot of that as we go through today. What I wanted to talk about specifically relating to the hypothetical is about this thing that I've been seeing a lot on Twitter, this thing that's been discussed a lot. But specifically, I want to start with something that recently was announced about, specifically the Trump administration and President Trump's response to COVID. Gonna move my camera. Let's see. Move this over here. There we go. I'm gonna watch this clip, and then we're just gonna go from there.
Scott, that's right. This is reporting from NBC News' Jeff Bennett, who is reporting now that there's a new plan at the White House for how to deal with coronavirus testing at the federal level in states across the country. Jeff Bennett reporting that the Trump administration is planning to end its funding and support for coronavirus testing sites at the end of this month. That is on June 30th. The administration is billing this as an effort to broaden community testing, put more emphasis on public-private partnerships such as pharmacies, CVS, Rite Aid, and facilities like that. The Trump administration initially planned to transition what's called the community-based testing sites program to local control back in April, but they held off on doing that. Now the plan is to do that by the end of June. As of today, there are 13 federally supported testing sites in 5 states. Importantly here, 7 of those sites are in Texas, which has been seeing a resurgence of the virus. And a spokesman for Texas Republican Senator Ted Cruz told NBC that he has urged and will continue to urge HHS and FEMA to extend the community testing sites in Texas. So at least Senator Cruz not entirely on board with this plan now to end those federally supported testing sites and transition to this public-private partnership model. And of course, Scott, as you know, this all comes at a time after the president has stoked some controversy by suggesting at a rally last weekend that he wanted to slow testing down in this country. The president's aides immediately came out after he said that and said, no, president's just joking. That's tongue in cheek. The president then corrected his aides and said, I don't kid. He's tweeted and said a number of times over the past several days that he views testing as a double-edged sword, that he sees the idea of testing as resulting in an increase in cases, and he doesn't like to see that increase. So not clear whether this move is connected to that impetus on the part of the president, but clearly his critics will say he's shutting down federal testing at a time he wants testing to slow down. The administration saying, no, this is not that. This is moving toward a public-private partnership mode, but this is something to watch, Scott.
Yeah. Eamon, thank you. Interesting.
Yeah. It's pretty fucking yikes, right? Now, there's going to be a lot of discussion about, oh, this is just we're moving towards a different model. This is moving towards a different model, but we're going to be able to retain testing. This is ceasing federal funding, all right? This is relying on states and local organizations to be able to fund the ability to test, right? And that's fucking terrible. Because right now, more than ever, we need the federal government to be able to provide assistance to many different state organizations to be able to help deal with this crisis. I don't know if people remembered a couple months ago, but there was a lot of discussion about how states essentially had to bargain with each other or bid on being able to get ventilators, right? And then there was the whole debacle where Elon Musk tried to buy where he tried to buy a bunch of ventilators, but he ended up buying the wrong machine entirely and wasted a bunch of money. And wow, private ownership really fucking failed us, didn't it? This is the worst decision that could be made at this time. And I really want to talk about the gravity of this situation because there are going to be some people, like people from this hypothetical family that we talked about at the beginning, who are going to be like, well, hey, maybe this is a good thing. Maybe this is something which is warranted at this point in time. So I want to address that. Here's something from NPR. Tracking the pandemic. Are coronavirus cases rising or falling in your state? Let's just talk about it. More than 2 million people in the U.S. have been tested positive for the coronavirus, and more than 120,000 have died. Through growth in new cases slowed in late spring, by mid-June, new cases began to trend upward nationally. In the graphics below, explore the trend in new cases in your state to see whether cases are rising or falling, or staying level. You can view the case through the different graphics. I want to focus on this, right? And we're going to look at a couple different ways that this has been articulated recently. Florida is one of the cases that has been, or this is one of the states which has been like drastically de-escalating coronavirus restrictions, regulations, etc., etc. Florida, average this week, 4,745 new cases per day. Here's the percent change versus 2 weeks ago. 250% increase. Texas, 4,968 new cases per day. Percent change versus 2 weeks ago, 181%. Arizona, 2,821 new cases per day. Percent change per week, 130%. And it goes on and on and on and on. And this is not good, folks. This is really, really not great. There are a bunch of different graphics. I recommend that people look at this. This is a great way to look at it. But here is, let me find it. We'll be going to all these. Hold on, I want to find this on my Twitter. This is something that it's an infographic that's been going around a lot recently. Yeah, I knew it. That's a really good infographic. Where is it? Here we are. Okay. Daily new confirmed COVID cases, or COVID-19 cases per million people. This is us compared to other major countries in the world. I want everyone to look how pretty much everyone experienced a massive spike. And you notice how like everyone seems to be going down over time. You got the United Kingdom, you got Canada, France, Australia, Italy. Pretty much all of them have been, flattening out the curve pretty well. And then there's this random child up here. What are you doing? What are you doing, United States? Wow, you're really winning, aren't you? You're really winning the national competition, the worldwide competition to get the most, right? You got the biggest number. Congratulations, you win. Hooray. I'm sorry. I want to take this more seriously, and it is something to be taken seriously. It's something to be taken incredibly seriously. But wow, I really cannot stress to people enough the importance, the gravity of the fact that we are doing terrible compared to the rest of the world. Exactly. We are really doing just, God, awful compared to the rest of the world, and people are dying as a consequence of it. U.S. coronavirus cases surged to the highest daily level since pandemic began, says Democracy Now! The United States reported nearly 370,000 coronavirus cases nationwide Wednesday, the highest daily toll yet, as much of the U.S. and the West barreled towards a new deal and dealier phase of the pandemic. Florida, Oklahoma, South Carolina, and Texas all confirmed record numbers of new COVID-19 cases, with infections increasing in 29 states. In Houston, the Texas Medical Center reports that 97% of its intensive care unit beds are full. Officials are planning to convert standard hospital beds into ICUs, many of them staffed by medical workers who don't have experience treating critical care patients. California hit a record high 7,000 new cases Tuesday, as Governor Gavin Newsom warned residents to follow mandatory mask use and social distancing requirements or face a new round of lockdowns. Disneyland in Southern California said that it's abandoned its plans to reopen the theme park on July 17th, and so on and so on. People. I understand that, like, there's a lot of people. Actually, we'll go on and finish this, because, like, there's a really good point to make. Like, it's really important to understand, like, where people are coming from who are opposing the fact that this is actually a legitimate issue, right? Who warns that coronavirus has yet to peak in the Americas. I want people to consider, for as bad as it is right now, it can still get worse. It's still getting worse, especially if we don't do anything. In Geneva, the head of the World Health Organization, this is no schmuck, right? Like, this is the head of the World Health Organization, Tedros I don't know how to say it. I have no idea how to say that last name. I'm so sorry. AG, warned Wednesday the pandemic will soon reach a grim milestone of 10 million confirmed coronavirus cases. 10 million. This is Dr. Mike Ryan, head of the WHO's Health Emergencies Program. This epidemic in the Americas, in general, is still intense. It's particularly intense in Central and South America, and that's across a range of countries. And we've seen a steady and worrying continuation of trend, with many countries experiencing between 25 and 50% rise in cases over the last week, which means many, many countries in Central and South America and in the Americas in general are still sustained community transmission. This is really tough, right? Because this is one of those things. This is one of those things where, like, and this is probably the reason why I, joked a little bit earlier, is that at some point it just kind of feels like you're screaming into the void, right? Like, there's so much overwhelming evidence to show that this is a legitimate issue. And yet there are people who still disagree. Like, not only, like, right now we should be at the point where where if there is disagreement, it's in how to resolve the issue. That's the only disagreement that should be existing right now. All right? Because everyone should reasonably understand that this is an issue. And we end up with people who end up still thinking it's a problem. For people who are watching who still don't believe this is a problem, I want you to understand. I want you to really critically think about the sources that you're listening to. I want you to critically think about, like, where you're getting your opinions from and whether or not you're critically evaluating the things that you have been told. I want to say there is a very high likelihood that you're getting that opinion from very far right pundits, and you do not want to be listening to them right now. Believe me, they have monetary incentives to say the exact opposite of what is true at this point. And what I want to make sure is that you don't end up. What I want to make sure of is that you don't end up like these people. Here's the headline: Anger erupts as mask mandate pass in Palm Beach County. I want people to just understand. These, like, what you're about to see are people who are just going to a town hall to talk about a mandate to wear masks in public. That's it. Okay? That's the only thing the mandate does, or the primary thing. These are the responses to it.
You literally cannot mandate somebody to wear a mask knowing that that mask is killing people. It literally is killing people. And we the people are waking up, and we know what citizens arrest.
Killing people. No citation, no evidence. Completely out of the fucking, like, completely just the most far left thing. I heard this and I was like, what the actual fuck are you saying? The masks are somehow killing people, but wait, it gets better.
Because citizens arrests are already happening, okay? And every single one of you that are obeying the devil's laws are going to be arrested. And you, doctor, are going to be arrested for
the devil's laws. You heard it here, folks. The devil's in the details. The devil's the one writing these laws, and apparently the devil is killing people by making them wear masks.
crimes against humanity.
The problem with humanity today is ignorance, arrogance, and apathy. Keep taking the road of least resistance. Keep listening to the TV brainwashing you from birth.
And they want to throw God's wonderful breathing system out the door. You're all turning your backs on it.
I really have many question marks about your degrees and what you really know. I'm sorry, ma'am, but I don't think that you are worthy of your credentials. And I would ask suggestively that you go back to school and get educated.
These are people literally just complaining about a mandate that you have to wear a mask in public. Listen, people, I'm going to be entirely real with you because it is very hard for me to take these people seriously because you take one look at them and, like, I don't think that I have to make a very complicated or very nuanced argument to be able to demonstrate that these people are completely unreasonable. They just are. All right? Like, there's, like, I don't want to take this seriously. I don't want to respond to it in a serious way and try to make it seem like this is a credible or a reasonable point of view because it's just not. And it sucks because at some point, I really want to be able to reach these people because, like, these are human beings just like you and I, right? Like, I do want to help them. I do want to make sure that we minimize the loss of death to any person. I'll give the caveat here. For as much as I think that these people are being absolutely ridiculous, I don't want anyone to die because of this. At all. But what's important to recognize is that when we are dealing with something like a pandemic, we are all in this. We're all in this together. You get the idea, right? We're all in the same boat. And I just really want people to recognize that, like, even if you don't agree with this, even if you don't fully believe it, even though there's this overwhelming totality of evidence, mind you, we just kind of tipped off the iceberg. There is so much more out there, right? I just want you to consider the possibility. Just, like, consider the basic possibility that maybe, even if you don't believe it, it wouldn't be the worst thing to just wear a mask. That's all I'm asking. Wear a mask. Wash your hands. Keep hand sanitizer on you. I don't know how this is killing people. I mean, it's literally, like, the most basic thing to ask of people. I don't think it's asking all that much.